Hello viewers, this is your host Neha, and today I'm here with Pune's famous neurologist, Dr. Sagar Bhalerao. Hello, sir.
Hello.
And yes, we are going to discuss prostate problems, what is BPH, and everything about this problem. So I want to ask you, doctor, what is BPH?
BPH means benign prostatic hyperplasia. That means it is the age-related non-cancerous enlargement of the prostate. So, this happens when, as the age advances, there are certain hormonal changes in males, and gradually, this is a prostate gland which is present in the body, which is responsible for production of semen, and this enlarges and starts to cause urinary problems. So whenever a aged male has urinary issues, mostly we have to see for the prostate enlargement.
For it. So the next question would be, what is prostate?
Prostate is a small gland which is present in all males, and it is an important reproductive organ. Now, the critical location of this gland makes it prone to cause problems in the later life. It is present in the urinary tract. So, as it enlarges, it starts blocking the urinary tract, and that causes urinary problems in the males. As and when, so there are many problems which occurs as difficulty in passing urine, then sense of incomplete passage of urine. These all problems are painless. इस पेशेंट को कुछ पता नहीं चलता कि प्रोस्टेट बड़ा है कि नहीं, क्योंकि उसको दर्द नहीं होता. दर्द जब होने लगेगा तो it is a very late stage. So it is actually a painless problem, and it mostly starts with waking up at night to passing it. So if some elderly person in your house is waking up more than 2 times to pass urine at night, which he was not having earlier, you should definitely look. It is an early sign of prostate enlargement, and definitely उसकी तरफ ध्यान देना चाहिए.
Okay. And symptoms क्या है डॉक्टर इसके?
प्रोस्टेट एनलार्जमेंट के सिम्टम्स में दर्द नहीं होता है. उसके सिम्टम्स ऐसे रहते हैं कि पेशेंट को यूरिन करने में तकलीफ होती है, जोर लगाना पड़ता है, कभी कभी यूरिन होने के बाद पूरा यूरिन नहीं हुआ ऐसा लगता है, कभी कभी बार बार जाना पड़ता है यूरिनेशन के लिए, अर्जेंसी बहुत होती है यूरिनेशन के लिए, कभी कभी थोड़ा बहुत लीकेज होना, और रात को सोने के बाद बार बार उठना. ये these are the most common complaints which a patient faces.
All right. Are these troublesome symptoms as well?
Yes. These are, I can't say it is a troublesome, but they are definitely bothersome. So these definitely affect the lifestyle of the patient. So patient automatically searches for bathrooms when he is going outside. He has to be aware कि अगर उधर bathroom है. He automatically chooses a mode of transport, such as train or flight, where the bathroom availability is easier. And definitely avoids and bus travel because of urinary problem. So these are definitely troublesome and bothersome in many patients.
All right. Is BPH a sign of a cancer?
No, BPH means just enlargement. Now, why that enlargement has occurred, that has to be investigated by a urologist. Few patients of this enlargement could be due to cancer also. लेकिन ऐसे पता नहीं चलता है कि ये जो enlargement है वो कैंसर की वजह से है या नॉन कैंसरस enlargement है. So any enlargement at a senior citizen level age, obviously steps have to be taken to ensure that it is not a cancer.
All right. So, is this condition a rare condition, or is it like it is very common in males?
Prostate enlargement is very, very common. It occurs in almost all peoples above the age of 50. Almost 50 to 60% people above the age of 60 will have some problem related to prostate. Once the age crosses 75, 80, definitely 80 to 90% people will have this problem. It is a very, very common problem. Only thing is that because it is not painful, because most of these people are retired, they have easy access to bathrooms at home, and they prefer going to bathroom and again, still it creates some major issue. I would suggest the people to bring them early and get rid of this problem.
So how is BPH diagnosed?
See, BPH is diagnosed by mostly physical examination,
Mhm.
then certain blood tests like PSA, then certain common tests like sonography of the abdomen, and the special prostate sonography like transrectal ultrasound. And it can also be seen in other investigations like MRI and all that. Certain more investigations specific like uroflowmetry has to be done to check the flow of fluid, so that we can be more accurate about the diagnosis. These are very common. Just blood test, urine test, and physical examination are enough to get the diagnosis of benign enlargement.
So, doctor, what are the treatments are available in the market for BPH, and which are the most effective ones?
So, if you look at the treatment aspect, the most common and most effective treatment are tablets, which can be started as a very early stage, and these have potential to shrink the prostate over the long period of time and help to reduce the problems of this. These are quite effective treatments available, and other treatment options are surgical options also, in which the enlarged prostate is taken out by surgery. Today, the surgery happens with the laser technology like holmium laser of holmium laser, and with this technology, there is a very quick recovery of the patient. Laser removal of prostate is one of the very good options. These are very effective options, which will help the patients. And surgical options have the potential to allow to stop the medicines also. If the patient is taking medicines, he will definitely affect. The medicines are not helping. Surgical options are there, which the prostate can be removed and patient can be cured of the problem.
All right. So, is there any specific age group that is get affected, or is it like it can happen to any?
So, elderly age, so more than 45 to and above males are affected by the prostate problem.
Hmm. All right. And the last question I want to ask is, what are main concerns of urologists that can affect the treatment of the patient?
Yeah. So, main concerns are the other regular prostate other problems which are related or unrelated, such as if the patient has some kind of blood pressure or diabetes, or he has some neurological problem. There are other comorbidities that we tell, such as any asthma like issue. So these all problems might cause some changes in the prostate treatment. So these are the cuts. If the patient is some blood thinners, and if he gets a urine infection, there are chances that he might lose blood through the urine. So this is a possibility. The patient has very high BP, then medicine doses need to be changed. If the patient has diabetes, then other problems of bladder weakness, muscle weakness can complicate or make the treatment difficult.
Is there any precaution that one can take to avoid this problem?
Um, you have to regularly check your physical checkup. Your regular health checks has to be done. You have to make sure that the sonography and the blood test related to prostate are included in that test, so that this problem can be treated at an early age. As there is a problem of aging, then you cannot really get away from it. But if you can detect it early and treat it early, then future problems can definitely be avoided.
All right, this is it, everyone. Thank you so much, Dr.
Thank you.
Sagar Bhalerao. It was nice meeting you, and I am really sure that this information is going to help you all. And I hope we are succeeded in spreading the awareness of BPH.